My name's Patrick Fine. I'm the Chief Operating Officer for FHI 360. It's an honor to be here and to welcome you all to this session, which is co-hosted by FHI 360, by the Packard Foundation, and by the UN Foundation. We're thrilled to have you here, and it's great to see such a big turnout. If you're here, what it means is that you're a connector. And before we go any further, I want to ask everybody, if you have a cell phone, would you please make sure that it's turned on and that you're tweeting and photographing and connecting throughout our session. Yeah, with the ringer turned off. So, all right, the connectors are here because we all share an interest in social good. We all share an interest in using innovation, technology, and media to drive solutions to human development, to build a better world, and today, to use those tools to focus on family planning and reproductive health. We've got a terrific program, and we are expecting, as a keynote speaker, Dr. Babatunde, the Executive Director of the UN Population Fund. I understand he's stuck in traffic right now, so which we can all relate to. So as soon as he gets here, we will we'll welcome him and listen to his remarks. In the meantime, I want to start the program because there's not a moment to lose, and we've got just an amazing set of ideas to share and to discuss amongst ourselves. And I want to welcome our facilitator, Julia Wicklander. Julia is from Sweden. She is the founder and the director of Girls Globe, which is an online network of bloggers and organizations dedicated to improving the health, access to human rights of women. Julia, will you come up and will you lead us through this amazing program? Thank you.
What a crowd. Thank you so much, Patrick, for that introduction, and likewise, I am so thrilled to be here, and I'm really happy that Girls Globe is part of this event. I will be telling you more about Girls Globe, and we have some bloggers joining us for the media panel later today. As Patrick mentioned, we will be covering a spectrum of issues related to family planning, and we have experts and specialists that will be talking about media, about mobile technology, about youth engagement, partnerships, and we have a range of passionate individuals who are here to inspire you, and all of these individuals are, in their unique way, champions for family planning. And we are really thrilled and we are very excited. And I believe that all of you will leave here today with new motivation and also new inspiration. On that note, we want to invite you to be part of the conversation. We have experts with long resumes that are fantastic speakers, but we also want to invite each of you to be a part of the conversation. How that will be possible today is, first of all, you can use the hashtag ICFP Live to share your comments, and those will be a part of a storify that we will put together after the event to capture all of the online conversation, both the conversation that is in this room, but also for those that want to be a part of the conversation that aren't able to make it today. But if you have specific questions that you want to ask the panelists during their talk, please tweet your questions to @FHI360 using the hashtag ICFPLive. That hashtag is the hashtag of the week, so just remember that. And we will pick out a few questions after each panel to address them directly to the panel. Also, in the spirit of plus social good, we are recording this whole conversation today. It is being video filmed. It is not live streamed, but it will be pushed out to several thousand people who will be a part of this conversation throughout the week. This video will become available later this week, and we would love it for you to share it in your networks too. And one last housekeeping note before I introduce the first panelists is that, of course, keep your cell phone on. We want you to engage. But also, throughout this week, FHI 360 is, together with partners, putting together daily deliveries that are sent out to all the conference attendees, but also several thousand people who aren't able to make it to Ethiopia this week, to be able to really facilitate a global conversation, because we want to engage people not only who are able to come to Addis, but people all over the world. So make sure to check out the hub, which is on FHI 360's website. If you, under your chair, if you might be sitting on it, or if you picked up some flyers, there is a little, with beautiful pictures on the back, it says the address to where you can find the hub. And the hub has blog posts, videos, interviews, and a lot of inspirational material that comes from all sorts of organizations that are active here at the conference this week. I think that's it. Thank you. So I have the pleasure to introduce the first panelists, and it will be a talk about partnerships. I would like to welcome Jessica Dorney-Schwartzman and Sandra Jordan to the stage. Jessica is the manager for the Rights and Empowerment Working Group for the Family Planning 2020. She has been a part of the United Nations Foundation's initiatives for women and girls and population issues since 2010, and has experience with several partnerships with NGOs, UN agencies, the private sector, and the US government. Which takes us to Sandra, who is Senior Technical Advisor and working with External Relations at USAID, and USAID's Office of Population and Reproductive Health. She is liaising with various stakeholders, including civil society, the UN, NGOs, donor partners all around the world. And she's also very active with the Family Planning 2020 initiative on behalf of USAID. So, before this panel starts, as we have our keynote speaker, thank you, Babatunde. Come on up. Patrick has a nice introduction here for you.
We're all thrilled to have Dr. Babatunde with us. He's been a leader in the area of public health, global public health, for more than 3 decades. He's somebody that we all look up to, and it is a great honor to have you join us and give us, share your thoughts with us. The previous slide said inspirational conversations. And it's an inspiration to have you with us and to have you lead off this Plus Social Good Forum. Dr. Babatunde is the Executive Director of the UN Population Fund. Before that, he was the Minister of Health in Nigeria, and he was also the Director of the Nigerian National AIDS Commission. He's been on dozens of advisory panels and commissions, far too many to note. He's a person that is looked up to around the world for his contributions to public health. Dr. Babatunde, thank you very much.
Thank you very much. Let me first apologize for coming a little late. I was trying to arrange how we would expand family planning services in Africa through the Economic Commission for Africa, the United Nations agency. It's a pleasure for me to be here and to share with you my thoughts and to let you know that at UNFPA, we believe that family planning is one of the most important social goods. Now, I think it's very fundamental. Fundamental in terms of the fact that I think it's a right, and I think family planning is the basis for human development. And all of us must understand why that is so. And let me take you back memory lane. The United Nations and the UNFPA actually started family planning in 1969, the UNFPA. So for over 4 decades, we have been at it. But there have been issues back and forth. And until 1994, when we had to redefine ourselves through the International Conference on Population and Development and recalibrate what family planning should be and how it would affect the lives of people. And that recalibration brought people back in the center of development, in which circumstance the choice that a woman makes today is going to affect who she is and what she becomes in the future. The choice that a girl makes is what also would eventually become what transforms her and what makes her a useful member of the community and someone who can contribute social good. Now, in a sense, all of that is predicated on our ability to make choices and to be able to access family planning. And I think many of us must think about it in order for us to appreciate it. I was in Nigeria last week, and I was at a school where we had, UNFPA was working with young women between the ages of 10 and 14. And they had mentors, and I was listening to the conversation. I just sat, I didn't make an intervention, I just listened to them. And it's amazing how around the world, there are so many young people, there are so many young girls who have been denied even that self-confidence to be able to express themselves, to be able to explore the world, to be able to ask the question, why am I here? And what can I contribute? How do I add value to my environment? And what do I want to become? And how do I get there? And all of that. Now, it struck me that we as a community must go beyond just provision of services. We must also engage with communities to make social change happen. Because if that doesn't happen, we are not going anywhere. And I think, for me, that ability to change, that ability to transform, that ability to take a 10-year-old and make her see what she can become 20 years from now, and the possibilities that exist for her to do so, is such an empowering thing. And you can make sure that that happens because we have the skills. All of us have the skills, and all of us have the power to do so. Working with governments, of course, and communities on the ground. So, in my view, that is what we have to do. Now, We're here in Africa, and I think the greatest challenge this continent has today is working with its young people. 1.2 billion young people in the world, 90% of them in the developing world. Most of them on this continent, or a good part of them, maybe 40%. You are going to have to work with them. You are going to have to transform their lives. You are going to make them be part of thinking and be part of change to enable things to happen. And that comes back to our ability to create social change. I can tell you that every time I go to Nairobi and I sit with a group of young boys who are playing around with ICT, I'm totally impressed by what they're able to do and what is possible for them to accomplish. So let's come back to the issue of family planning, because I think we probably do not quite understand what that means for people around the world. This month, we launched a report on teenage pregnancy. 7.2 million girls get pregnant every year. Now, most of them don't want to get pregnant. And when you talk to them, it is about their inability to make those choices I've just talked about. When you talk to them, it's about the abuse of their rights. It's about getting them married at 12. It's about sexual-based violence. It's about the fact of conflict in their countries. And so we need to address that. And I think that is something which we have to place in our purview. Now, I'm glad that this conference is addressing the issues of young people. That is the frontier and the barrier that we are at this point in time. And we must find a way of doing that basic good to everybody. I'll tell you that one of the mantras that I've talked about is about these 600 million adolescent girls in the world today. And there are 600 million of them who are waiting for all of us to intervene in their work, in their lives. And I believe that if we do what we have to do to each one of them, create a safe space for them, get them to get education and skills, entrepreneurship, access to credit, we can transform them and the world. But how can we do that? What are the things we have to do as a community? And UN Foundation is focused on the issues of the adolescent girl. I think we need to take it a notch up. There are three things that are out there that we have to talk to. The first is that we are currently reviewing the International Conference on Population and Development Program of Action. And that is going to give us an opportunity to reaffirm, and what we are looking at is what are the growing points in population and development? What are the things the world needs to do to take this beyond Cairo 20 years back? And we've done regional meetings. We've come to a point where we realize today that the world is waiting for us to do that. Comprehensive sexuality education for the girls, making sure that we provide information and services and youth-friendly services, making sure that we protect their rights, making sure that we respect each person's sexual values and rights. The world is talking about it, and I think we need to take that. So we can get all of you to participate in that conversation wherever you are would be very good. The second is, of course, how this fits into the next development agenda. We're at a point where we are determining that development agenda. There are three entry points that I want you to look at. The first is the entry point under universal health coverage. We must ensure that the issues of sexual reproductive rights, health and rights come into that, family planning being the entry point for all of that. We must ensure that it is protected and it is not lost in the whole gamut of universal health coverage. The second opportunity with that is the gender. We have a gender goal that is being put together by UN Women, and within that is also reproductive health and rights, and I believe that that's something we all must support so it can go through. And the last, which UNFP has put together, is a youth goal. And that youth goal is what is going to make the difference, I think, in a place like Africa, where we must hold governments accountable to training, educating, providing services, entrepreneurship training, skills development, making sure we can create jobs for young people, making sure that all of the resources that are coming from the extractive industry of Africa is actually, reinvested to building human capital. Because that is the only sustainable way that the world can grow. And I have heard an argument this morning, for instance. How can we stop Africa from growing in terms of population? The best way is to educate girls. Because once girls are educated, they make different choices. The best way is to retain them in school, because once they're in school, they don't get pregnant. The best way is to provide them with skills so they can get jobs, so they can become people of substance in communities. And I think it's possible. I think it's doable. We've seen considerable change in governments in Africa. Rwanda is done very well. And there are many other countries in Africa that are actually on that path. And I just want you as a community, with me as part of that community, to continue to preach this social good, where the adolescent girl is in the middle of it, and she is the agent of change that we must build. I thank you very much.
Thank you, Dr. Babatunde Osatimehin. On that note, such a positive note, I'm really inspired, and I think that it is possible. That is something we should keep with us, and girls are in the center. So one of the ways that is possible is through partnerships and through collaborations. So I want to welcome back up on stage Jessica Dorney-Schwartzman and Sandra Jordan. Jessica from the Family Planning 2020 Initiative, and Sandra Jordan, who works with external relations as Senior Technical Advisor at USAID. They will have a collaborative discussion about partnerships.
Follow Dr. Babatunde because he's always so inspiring and hard to follow, but we'll do our best. So yeah, I'm Jessica, and as they mentioned before, I am working on FP 2020. It's been a really, really exciting movement, and I've been focusing mostly on the Performance Monitoring and Accountability Working Group in Rights and Empowerment, and I see a lot of my colleagues out here. But I've been at the UN Foundation for almost 4 years, so it's great to be a part of this event.
And I'm Sandra, and I've been with USAID almost 13 years, which is kind of shocking. It's still not working? Okay. And Jessica and I are a perfect example of partnerships, because when she started working on rights and empowerment, we became very good partners. So I'm really pleased to be here with her. And so how do we forget how we wanted to start this.
You're
going to let me start. Okay, I was just going to kind of give a brief overview on USAID and our partnerships. And when I first started at the agency, now that I revealed how long ago that was, USAID was increasingly getting into partnerships because they saw how the development agenda was changing, how resource flows to countries were changing, and it just started making a huge amount of sense to not keep going it alone. And there have been increasing numbers of donors coming on board, so cooperation got to be really, really important. So we began working with an array of non-traditional or non-conventional partners, as defined by development agencies up until the 90s and early 2000s. And so we've done everything. We've partnered with everyone from pharmaceuticals to industries, both within the US and within Europe and developing nations. And we just try to leverage money better so that we could do more for the women that we're trying to serve. And we've worked in other than the company partnerships, we also have realized increasingly with the development agenda that donors weren't coordinating quite as well as they should. So we've started several partnerships to just get better donor coordination going. One is the Alliance for Reproductive, Maternal, Newborn, and Child Health. And the other is the Ouagadougou Partnership that they spent a day yesterday kind of going through this, that we partnered with the French government and several foundations, including Bill and Melinda Gates and I'm just lost at Hewlett. And so we're seeing that this is working, and what we have seen through all this too is that it's really essential to force donors to work together, because we don't necessarily sit down and think to do it. If you have weekly phone calls, you do. So that's been a really good idea. But now we're also part of the biggest partnership of all, and this is where Jessica gets to step in.
Yeah, so FP 2020 is a global partnership that really carries forward the momentum of the 2012 London Summit on Family Planning. And it was established to really, as Sandra said, increase coordination and collaboration, and is a platform for knowledge sharing and to share best practices, emergent thinking, and to allow both donors, the private sector, countries, and civil society to really align their agendas and really, utilize existing structures, not create new or duplicative structures, but to build off of existing structures, really to deliver for the promise of reaching an additional 120 million women and girls with access to voluntary family planning, information, services, and supplies by 2020. And FP 2020 has a governance structure by which we all work, and that includes a reference group, which Babatunde is the co-chair, a task team, and we implement day-to-day activities. It's hosted at the UN Foundation, and 4 working groups. My brilliant co-host here is on the Rights and Empowerment Working Group, and there are other colleagues out there that are on working groups. So we have the Rights and Empowerment Working Group, Performance Monitoring and Accountability Working Group, Market Dynamics, and very much importantly, the Country Engagement Working Group. But I was at a panel yesterday where people were talking about FP 2020, and someone mentioned how important it is to recognize that the governance structure is a place to start, but this is really a movement. And we've seen so much. I think one of the great things about FP 2020 is that it's given visibility to the issue, but also energized. I think so many people were waiting for a moment in particular for family planning, and it's, I think almost 25,000 individuals have reached out and said they wanted to be interested and engaged in this. So one of the important things about FP 2020 is to keep this, harness this energy to move forward to really deliver for these women and girls. And so I think, there is this huge constellation of partners, but countries are really at the heart of this partnership. And they are really the ones, we're launching our first progress report tomorrow, which is very exciting. But they're really driving progress and delivering on the commitments that they made. So at the London Summit, 24 countries made commitments, policy, service delivery, and financial commitments. And over the past year, over a quarter of these countries have developed new and launched new costed, detailed family planning plans, which is amazing. 1/3 of the commitment-making countries have already increased their national budget allocations, including our host country here, Ethiopia. And half of the commitment countries have held national family planning conferences. And we're really hearing from the governments and civil society themselves that these are great moments to really profile high-level political commitment. I think in Indonesia, when they had theirs, there were almost 1,700 people there that attended within the country, including the vice president. So, yeah, and so that's kind of the broad countries, but I know USAID's doing a lot of work down to the community level.
Yeah, so kind of echoing what Dr. Oshtomen was saying, we feel that social transformation is really part of family planning, and so often it's looked at as either health or this or that, and we just think it's really transforming society simply because giving women the access and right to contraception and allow them to plan their families is kind of a huge concept that really hasn't quite been adopted in my country. So there are obviously many countries that can use we need some social transformation as well. So we do work closely at the community level, understanding all the big partnerships are important, but many of our implementing partners really dig deep into the community, working with community-based health workers who take supplies out to remote health centers in the mountains and such, and you kind of see these workers walking from a hospital base and walking here in Ethiopia 20 miles uphill to get contraceptives to a remote clinic, and you're thinking, you do this every day? And so the dedication of women and men who want to make these services available is extremely impressive. We build on social franchises through MSI, and that's taking private clinics that are very much respected by the community, and training them and teaching them in family planning and letting them make things accessible. So we've got both the public and the private going. And working with community leaders to kind of put the seal of approval on family planning, on the fact this happens. We've got a lot of programs working with mothers-in-law who sometimes can be a barrier to access, or husbands, getting a lot of male involvement going, and this is very much done village by village at the community level. And so that kind of, I've got a million examples. I'm trying to be mindful of time. And Jessica, what?
Yeah, so I mean, I think one of the challenges you talked about were, making sure that women and girls have access to a full range of methods, and no matter where they live, that should be an option, and to ensure that they are of high quality and that they can make informed choices. And in order to do that, I think at FP 2020, there's been a lot of focus on ensuring that women, when they're getting these services, there's a broad range of methods in the method mix. And I think innovation is something else that FP 2020 has really focused on as a core principle, and that collaboration, is essential in order to innovate. So some of the most exciting innovations over the past year have really been between the public and the private sector, and using market-based solutions to ensure that, to solve some of these problems. So some of the exciting things, that have come out of this are both that there are important underutilized commodities that are in demand that have had, 50% price reduction, and that is making, this is a public-private partnership that USAID is a part of, the Gates Foundation, UNFPA, Pfizer, DFID, and so they all came together to work to make sure that, these commodities would be available when people want.
We did this through Merck and Bayer, and I see
Merck and Bayer,
partners
right.
in the room, so thank you.
No, that's right. That's right. They were on the long-acting. Yeah. I was thinking about the injectable contraceptives.
I'm sorry about that.
Yeah. Which
that's
are soon coming out. They're starting to pilot those programs as well. So it's very exciting. And I know, I think we talked a lot about the private sector and how, these public-private partnerships are important, but I know USAID's also working closely with the faith community, which is a different.
Yeah, a lot of people don't think you can say faith and family planning in the same sentence, but actually you can. And we started working very extensively with faith communities many, many years ago, even before George Bush. So we've recognized their value to our work for a long time. Given that 90%, or an estimated 90% of the world's people adhere to some religious belief, it would be really hard not to work with the faith community, and many of them really do want to work with us, even Catholic ones, and we have nuns that deliver condoms and other forms of birth control. We just don't tell the Pope. But maybe we can tell this one. We can see. And we also work with imams and mullahs and other Islamic religious leaders, work with Christian leaders, Jewish leaders. We even had a program, actually, that got us in trouble with George Bush because we're working with Suzanne Petroni sits right up and listens to that. We work with traditional faith leaders in Haiti, which is voodoo, and they got very upset saying that wasn't really a religion, but tell the Haitians. So anyway, we do work very closely with these people. They make it possible for us to do that social transformation we were talking about, to change hearts, to change minds, to gain acceptability for reproductive health, for the fact that women can be equal members of society, that they can get education, that they can contribute to the community, and ultimately make huge contributions to their countries. And a lot of religious leaders help us a lot in doing that.
So some good last words, I think.
We did get one question from, or a few, I think. I want to introduce our Twitter moderator, Matt Matassa from FHI 360, and he has a question for the panel.
Okay, we have a question that says, how do we ensure the voice of women and girls are heard in this discussion?
That's a good question. So, I mean, I think this constellation that we talked about with these stakeholders, and since we're here on technology, I mean, I think utilizing a lot of the platforms that we have to reach out and engage these communities. I think within the working groups that we have, we really made sure to have a diverse set of partners, some that represent youth, you know, in particular, and come from community based, so they can, you know, engage with these populations on a very regular basis, and that there's a feedback loop there. And I think, you know, also it's really important to have women and girls at the table when there's program design and you know, country plan development, and I think that's something we're going to be really committed to.
Excuse me, USAID has a new youth policy, and one of the things we're doing with this is not talking so much about youth-centered programs and making them youth-run and youth-created programs, because 40-year-olds creating programs for youth may get it wrong. And so we're working very hard doing that. And then a lot of our community outreach, when we do a lot of sitting under the banyan tree, talking to the communities, and we make sure that youth are there in those meetings and hearing what's going on and that they have a voice in all this. So it's not that we just trot them out for national and international meetings. They're there in the community meetings under the tree and such. So,
thank you. And we will hear more about youth engagement. I always like to say that young people are not the future, they are actually the present, and we have so many young people who are leading the way, and we will be hearing from a few later in a separate panel. Thank you so much. So next, I would like to welcome Ann Stars to come forward. She is co-founder and president of Family Care International, which is an NGO that is dedicated to making pregnancy and childbirth safer in developing countries. Ann has worked with the organization since it was founded in '86, where she has led the organization's development through both program design and capacity building in sub-Saharan Africa, Latin America, and Asia, and has worked with global advocacy and policymaking on specifically reproductive, maternal, newborn, and child health. Anne has participated recently in the New York City Marathon, and she will be sharing a little bit more about how we can all raise awareness and her experience on that. So welcome, Anne.
Thank you very much, Julia, and thanks for giving me this opportunity to share a little bit about my experience. I was asked specifically to speak about running the New York City Marathon, and specifically about what I did, which was to do it as a fundraiser and as an awareness-raising activity. I've been a runner for a long time. This was the second time I've run the marathon. The first time was 10 years ago, after 9/11. And to be very honest, we kind of came up with the idea of doing this as a fundraiser and as an awareness-raising event only a couple of weeks before the marathon. We used the website CrowdRise, which many of you nod or don't nod, shake your heads. Are you aware of this? CrowdRise it's actually a for-profit enterprise that was set up. I actually don't know that much about it, but it's a very versatile, flexible mechanism where individuals who are committed to a certain cause can put up very quickly a web page and then send out through various social media an announcement or a message appealing to a range of audiences to make contributions and to raise awareness. And so we did this. We set a fairly modest fundraising goal, which we exceeded within the first 36 hours of a message going out. So we then doubled the goal, and we exceeded that, which was a very welcome result. I think that for me, there were some interesting lessons learned from this experience. I am not, despite the title of this event, actually a social media expert by any means. In fact, I was looking at oh, wow, there's a picture of me. That was at mile 7.5. I didn't look that good at the end, I promise you. And the reason I'm standing up is because this was, I don't know if people know, this was a week ago Sunday. And I'm over most of the pain, but sitting down that movement of the quadriceps is still kind of painful, so I'm standing rather than sitting in the chairs to give this little talk. But some of the key lessons for me, first of all, was the importance of the personal connection. What we did was that I posted a message on my personal Facebook page. We posted a message on Family Care International's Facebook page, and that got some responses, but to be very honest, the big response that we got was when I sent out a message via email to about somewhere just under 300 of my friends, families, and contacts. Now, I think that's a generational issue, and I'll come back to that in a few minutes, that I think the response was much more to the email appeal rather than to the use of the social media. We did tweet about it a little bit as well. But I think a key element was in framing the message around this outreach and linking the cause that we were talking about to the personal experience. Because one of the things that I said in the message was that training for and running the New York City Marathon requires tremendous determination, sacrifice, and a tolerance for pain. But that's nothing compared to what hundreds of thousands of women in the developing world go through every time they go through pregnancy, labor, delivery. And trying to make that parallel and trying to make that concept around the challenges and the sacrifices and the risks that women face by going through pregnancy and childbirth, and by, in many cases, not being forced to go through pregnancy and childbirth when they may not necessarily want to because of the lack of access to family planning services. That making that message a little bit more personal, bringing that link to me, to someone that many of these people knew, helps to personalize it and helps to, I think, make it more something that people could, an issue that people could relate to. So that was one important lesson for me. I think another important lesson was the question, and many of you know this, when you reach out to people to raise awareness around these kinds of important social issues, you need to give them something to do. You need to give them an opportunity to express a view, to make a donation, to join a team, which is something we're going to do next year. We're actually going to create a running team for the marathon. At least I'm hoping. My staff said they were interested, and some other people said they're interested. When the time approaches and when the training starts to happen, we'll see whether that commitment really comes through. But I think that, again, that issue of that element of the challenge of making it not just something that you can push a like button on your Facebook page, but that actually even being able to write a message back or to post something is helpful. But then having at least the possibility of another action that they can take was really helpful. I think the third key message for me, and I alluded to this earlier, was around this issue of the generational divide in the types of social media that we use and how people access it. As I said, the response that got the most, or the outreach mechanism that got the most responses for us was an email. Good old-fashioned. Isn't that funny? How long has email been around? Not that long, but in this day and age, it certainly is old-fashioned. When they first had the introductory slide up for me, and it had the @NM_stars, I was like, what is that? And then I realized, oh my God, that's my personal Twitter address, which I basically never use. I tweet sometimes through Family Care International's Twitter account, but I never do it through my own. So I'm not that oriented towards the social media. I'm the mother of a couple of teenagers, and they use it certainly a lot more than I do, and use all these mechanisms that I don't even really understand how they work. I do use Facebook with my daughter, because whenever she's angry at me, she unfriends me on Facebook. So that's a really useful tool for me. But I think that there's a lot that can be done around social media, but I also do think we need to look at it critically and look at what is the impact on concrete outputs. What are the deliverables? What are the measurable outcomes of using social media? If we're trying to raise awareness, I think you can that's something that we can do through the social media, through Twitter, Facebook, many of those other mechanisms that I can't really name. But I think we need to look at, and I think we don't do often enough in the advocacy and communication field, to say, so what are we actually trying to achieve with the use of these mechanisms? And how can we, what are the more creative ways with use of video, with crafting messages, with crafting visuals that are highly effective, that are going to get people engaged? And I think that key thing of getting people to relate to what it is that we're trying to communicate about. My last comment is just going to be the appeal, the outreach campaign that FCI did around this marathon is, again, something that others have done. Many of you may be familiar with Every Mother Counts, the initiative that has been launched by Christy Turlington, which also has used the New York City Marathon and other running events to raise awareness and raise funds around these issues. And I think Every Mother Counts is a mechanism that's done a lot of work to reach out in particular to US audiences and try and get American women in developed countries to understand in a more visceral way what are the challenges that women in developing countries face. And I think that's a challenge that all of us face. Thank you.
Okay, we have one question from Twitter from Diane Fender. It is, what inspires you to advocate for access to family planning for women?
That's a great, I was really hoping that nobody was going to ask me what my time was in the marathon, so. That's actually, it's a great question. It's a very easy question for me to answer. When I first graduated from college and was thinking about what I wanted to do, and I knew I wanted to do something international. My father was a diplomat, so I spent half of my childhood outside of the United States, and I knew I wanted to do something about women and to help women and girls. And I think it's the ability to control their fertility is just such a fundamental need if women and girls are to realize their potential in life, that set me off on that path back in that long ago day. And it has continued to inspire and motivate me through the past 20 plus years that I've been working in this field.
Thank you. Thank you for sharing your inspiration, and I'm sure we have a girls Glober who would love to talk to you as well. She also ran the New York Marathon this year, and perhaps we could collaborate and do something together. To introduce our next panel, and who's facilitating this panel is Alexis Edinger. I don't know if I see you in the room. Oh, you're right there. Okay. Alexis is the Director for Social Innovation at the Institute for Reproductive Health at Georgetown University. She oversees the Institute's mHealth portfolio, strategy for solution implementation, and private sector engagement. Alexis has a near decade of experience in the field of social entrepreneurship and market-based innovations. And Alexis will be facilitating this panel that has to do with mobile technology. And I'll hand over the mic to you.
Thank you so much. We're so excited to be here. This is a great topic, and I think we have about 25 minutes to cover the whole world of mobile technology for reproductive health and family planning, so bear with us. Many of us know the stats now about mobile phones. 6.8 billion subscriptions globally. More mobile phones, people have access to mobile phones than they do other essential services like toilets and toothbrushes, and the list goes on. And rather than talk about the statistics surrounding this, we really want to paint a picture for what this means for family planning and development as a whole. Those statistics allude to the great reach, and that's the promise of mobile that we all really believe in. We've seen mobile do incredible things already for the development sector, providing financial tools for people who have never had bank accounts before, providing information on stockouts for essential medicines, providing prices for farmers so they can be more competitive in the market. So the question is, how do we harness this for family planning and reproductive health? How do we use this tool to make really transformative impacts for FP 2020 goals? And we believe that mobile phones have the potential to engage, to empower, and we have different perspectives up here on the stage today. I'm really excited to introduce these phenomenal women who are going to talk about different projects and innovations in the mobile space, but also broad sweeping trends, opportunities, and challenges. This is a new field. We want to have a pretty provocative conversation if we can. So without further ado, this is Kelly Langle with FHI 360. She is a health and education behavioral scientist, and she leads the M4RH program, which she'll be telling you about in more detail. M4RH, or Mobile for Reproductive Health, is an SMS information-based service that provides information to women, couples, young people about nine different family planning methods, and has a mapping tool to also help locate clinics where you can get these services. Welcome, Kelly. Next to Kelly is Maddie Navalu, and she's with the Global Poverty Project, and more specifically with the It Takes Two campaign in partnership with Women Deliver. Maddie is helping lead It Takes Two in asking, how can we engage youth through mobile and digital technology to strengthen their voice and influence policy for social change, especially in family planning. Maddie has great experience in building brands and grassroots advocacy campaigns for citizen engagement, so she'll bring a great perspective to this panel. Welcome. And finally, we have Laura Rainey, who's here with the UN Foundation. Laura has worn many hats over the years with Health and bringing this really to the forefront. She's here today representing MAMA, which is the Mobile Alliance for Maternal Action. And MAMA is a phenomenal private-public partnership that aims to provide information to pregnant women and new mothers about pregnancy, child health, and now family planning and postpartum care. Laura is an economist and a demographer and is going to have some wonderful perspectives to share as well. So, to kick things off, I tried to set the context a little bit about the promise of mobile health, so let's start there. It's pretty impressive statistics. How do we leverage mobile technology for family planning, and what has it been able to do for us that we haven't been able to do before in family planning? Why is it so game-changing?
Well, I'll start. On one hand, we have this huge unmet need for family planning, and we have unacceptably high maternal and child mortality rates. And on the other hand, as Alexis alluded to, 6.8 billion people in in the world have access to mobile phones. Almost 1 billion women in low and middle income countries have access to mobile phones. So what mobile phones are allowing us to do is to leverage this access to technology to get the information to the woman, to inform and empower women, in Mama's case about postpartum family planning messages, as well as maternal and child health messages.
Just to add to that, I'd say coming from an advocacy organization, the Global Poverty Project, working in partnership with another advocacy organization, Women Deliver, specifically engaging young people to take action, targeting leaders to keep them accountable for FP 2020 commitments. We're particularly interested in the power of mobile to bridge that gap between young people taking action and talking about family planning and the leaders who set policy priorities. Additionally, the statistics speak for themselves. Now, from our partner Everyone Mobile, we've heard that we're up to 90 to 95% of reach in most sub-Saharan African countries, which is an incredible reach. And the majority of mobile owners are men. We know that we need to increasingly engage men in this conversation as well, which is an additional benefit to using mobile as a tool. And even in the US, we've seen through our actions in support of family planning targeting US men and women, we've seen a rise in 25% just over a year, from only 15% taking action online to now 40% in some months, which is an incredible indication of the shift in markets.
Yeah, Kelly?
Hi, thank you for having me and for that great introduction, Alexis. So one of the things that is unique about our Mobile for Reproductive Health project is that it actually was started as a research project. And we really wanted to look at how could we use mobile phones to really engage and reach underserved and key populations for family planning. And so what we learned right off the bat was that there wasn't anything yet out there to research. And so we actually had to develop our own mobile phone platform, which we did, which is called Mobile for Reproductive Health. And so we've done research continuously on reach and potential impact. And so speaking to what you all were saying, what we've been able to see is that the reach out to men are about half of the people who use M4H, certainly women, also young people, and they really like getting mobile phone information, they like getting family planning information on their mobile phones, really for all the reasons you might think. It's private, it's free for them, it's comprehensive, no one has to see them going into clinic situations, things like that. And then the other really exciting thing about this reach potential is that it really is in urban and rural areas. So for instance, we've gathered data in Tanzania in partnership with Johns Hopkins, and we've been able to see that M4H users come from 127 out of 129 districts in Tanzania. So that's 98% of Tanzania, of the regions in Tanzania, people are using this particular platform, this mobile platform for getting this information. So it really is about empowering people from underserved populations with information to make informed choices about family planning. It's really quite extraordinary.
That is, I didn't realize that many districts. That's incredible. And it's not just that information, but Maddie, your project really takes information to the next level in action. I mean, all of yours does, but specifically there are action steps. Tell us a little bit more about sort of the reward system and the action that you're encouraging people to take.
Sure. So to give you an example, we recently were faced with a challenge with one of our actions, which was targeting young people all across the world to show their support for access to family planning services and information for every girl and woman to be a clear target in the new development agenda. We had no problem reaching out to our supporter bases in the US, UK, Canada, and Australia, but the Global Poverty Project doesn't have a supporter base in African regions, and specifically African countries who are on the fence on this issue. So we reached out to a mobile company called Everyone Mobile as a pilot, and they customized the language specific to every region. They made it fun. They added in a little quiz. And within just 10 days, we had 12,000 signatures from communities of young people saying that they very strongly were asking the UNSG and members of the SDG working group to include this in the new development agenda. Without this mobile partnership, there was no way we would have reached those numbers in that short space of time. And due to that, we're now exploring a much larger partnership with them across multiple African countries.
Thanks. And Lara, what about with through Mama or other projects you've seen? Tell us some success stories.
Mama was introduced in South Africa in May of this year, and it offers both text and pre-recorded voicemail messages in 5 different languages on different family planning methods, as well as pregnancy and maternal child health. And within 6 months, the demand was so great that they were able to reach 380,000 women, and the goal for the 2-year benchmark was 500,000. So they were almost, close to hitting 400,000 within the first 6 months of the program. Now, this is just piloted in 2 different inner city clinics in Johannesburg, and it will be, along with Vodafone as a partner. I wanted to talk more about the public-private partnerships. It will be going countrywide.
That's great. So I think all these examples really point to the promise of mobile, but let's break this down a little bit, right? We all know that technology is not a silver bullet. Mobile is just going to be one tool in our family planning toolkit. So let's take a minute debunk some myths or talk about some of the limitations that mobile still might have in front of it as we, early days, think about how to use mobile to successfully and realistically reach our FP 2020 goals. So kick us off.
All right, so we're hearing a lot about reach, and we're hearing some user metrics, which is always great. So when we look at the research, what we see is that these mobile phone programs, by and large, across the globe, have really high acceptability. People really like mobile phone programs, right? They like their friend in their pocket, and they seem to be pretty happy getting health information through their mobile phone. But here's the big question. What is the impact? We do not know. We do not know how people are consuming mobile content. We do not know what type of actions they are taking as a result of their exposure to mobile messaging. So evidence shows that strategic health communication can shift family planning norms and can shift family planning behaviors. But the mobile platform as a communication channel and as a tool in our family planning toolkit, it's brand new. And there are all kinds of questions that we have about it around how do people understand this content, how do they process it, how do they act on it, how do they share it. And we really need to look at the diffusion of these platforms, the diffusion of this content. We need to maybe apply social network approaches to it. The mHealth community and the public health community knows that research is sorely needed in this space. And I say shame on us as researchers and as public health professionals because mobile phone programs are being scaled up rapidly. And what the conversation is such that people feel that mobile phone innovation is in direct contrast to research. Research can be slow, research can be expensive. Our mobile health innovations, on the other hand, they're quick. We are iteratively and continuously changing them. We think we can reach a lot of people at a relatively low cost. And so there really is this direct contrast. It makes research difficult, but it's not an excuse not to do it. And we really need to prioritize research in this mobile technology space.
I think what Kelly said is absolutely right. Mobile technology, as exciting as it is, especially from a campaigning angle, isn't the silver bullet. When we're talking about behavior change, demand creation, you can reach thousands of people with an SMS, but that has to be coupled with peer-to-peer education, using influencers, champions of family planning. We can't look at mobile tech as a silver bullet in and of itself, and more research needs to be done to see how it can most effectively work in collaboration with the existing programs on the ground where we have the research on what really works for family planning.
I would strongly encourage public-private partnerships. It's mainly the success story in South Africa was due to the local partnerships within the country that enabled the program to move forward. So definitely work with local, know your audience, know how to move forward. But I wanted to touch back on something that we were talking about. Access to mobile isn't enough. And we can talk about the many different facets of access. It could be ownership to a phone. It could be using a phone that is in your village. It could be your husband or your sister's phone. But the fact is, most women do not have private access to a phone. So some of these messages, I think, Kelly, you could, and Alexis, you could allude to, even though we think we're reaching the women, and we are reaching some of them, we're still not getting to the last mile. And I think that's where we'll be heading in the future.
Absolutely. We found similar things in our programming as well, in that while you have access to phones, shared phone ownership is still very common in many resource-poor countries. And when we're trying to do very sensitive work around sexuality and family planning, we really have to be attentive to who's seeing those messages, who's getting the voice messages as well. We don't want to create more problems than we do solutions. So we're seeing positive trends, not only on that increase of ownership, but also what kind of modality they're using on their phone. We've started out basic calls, SMS, but as broadband increases, and Maddie, as you're campaigning, will be able to push forward there. I think there's a lot of promise.
I just want to comment on something. I think we have a tension here in our mobile phone innovations, and it's actually a tension that we see in the larger public health and family planning community, and it's the tension between taking global resources and global messaging and recommendations and tailoring them for the local context. And we all know that that's super important to do, and that in fact you have to do it. But one of the additional challenges, I think, in our mobile phone and family planning innovations is that you can start with the global, but how local do you need to go? Because it's a very tedious, it's a very time-consuming, it can be a very expensive process when you take that mobile content and adapt it to the local context. And I know for Mom in particular, Mom is very focused on that local adaptation. Our program, Mobile for Reproductive Health, on the other hand, is more focused on starting with the global messaging. It's based on the WHO Family Planning Handbook and distilling that information into the key, most important pieces of family planning information that people need to know about in order to make informed choices. But I think I just want to raise that because I think that's a real tension, and we don't talk about it very much, but we really absolutely need to be talking about it more.
Good point. And Maddie, have you seen that with your citizen engagement as well? Since you are global, how have you had to adapt your campaign?
Absolutely. It is always difficult adapting to the local market that you're working in. I think in our work, it's a little bit easier because our target in terms of the young people we're reaching are not those who need the contraceptives. They are the urban youth who are more educated, particularly in universities across countries like Uganda, who can have a stronger politically active voice and really become leaders. And the idea is that there will then be a domino effect, which will reach people beyond that group of more educated, politically active youth. So I think our challenges are slightly different to those that Mama and you face.
It is. So to wrap up, I can't believe we're wrapping up already. We are wrapping up. Okay, fast forward, it's 2020. Look into your magic crystal balls. We have achieved our FP 2020 goals. Tell us how mobile has helped us get there, maybe how it hasn't helped us get there. What's the future of mobile and family planning looking like? Want to kick us off, Kelly? No. Anyone else have an active crystal ball?
I'll just start by saying I think we're going to see a lot more creativity with mobile. Mobile in the next few years is not just going to be about SMS, it's going to be about online portals, it's going to be about games, how are we going to incentivize people with free vouchers when they take action via mobile. I think we're going to see a lot of this creativity come out, and it will be a complex space, but it will definitely increase our reach, and there'll be many different ways we can work with this technology moving forward.
And building on that, I think we will have learned the important lessons on how to incentivize people. I think we'll also have much more access of women to mobile phones, more smartphone technology, definitely more creativity, and hopefully broader reach. And we'll have tackled that question as information is just one part of behavior change, and hopefully we will have learned how to move beyond and also have some metrics, how we can measure the impact.
I will say two things. I think, first of all, mobile phones are going to be absolutely essential to us achieving our FP 2020 goals because they allow us to engage young people in ways we've never been able to do previously, and that's incredibly powerful. And then the second thing I want to say is mobile is being mainstreamed into everything we do. It's becoming a requirement when we work with our community health workers. They're all using point-of-care mobile technology tools. That's happening globally, and it's only going to increase all of our behavior change communication. We'll have a mobile component to it. All of our health system strengthening work will absolutely have an electronic and a mobile component to it also. So it's going to be a requirement. We're not going to think about mobile technology as anything special moving into the future.
It's less of an if, but a when for mobile. So I'd like to thank this great panel. I think you've raised some absolutely fantastic issues. Thank you. Give me a round of applause. And I encourage you all to join us in championing the potential of mobile in the future. It's quite exciting, and we think it has the transformative ability to really help us achieve those FP 2020 goals. So thank you again.
Thank you so much. No, we had several questions, but during the course of the evening, we know that these were answered. So I'm sure that we will reach out to you with more questions. So thank you so much. So for our next speaker, we have a true scientist. Dr. Willard Ward Cates is President Emeritus with FHI 360. FHI 360 is one of the largest and most active nonprofit organizations in human development within with field activities in more than 80 countries. And you are a scientist with years of experience in the field of biomedical affairs, HIV prevention research, and as principal investigator for several grants with USAID and Bill and Melinda Gates Foundation, and also at FHI 360. And I want to welcome you to speak about science and what science has to do with family planning. Thanks.
Well, thanks a million, Julia. And in the interest of time, I'm going to show, unlike what Kelly said with research being slow and costly, we are going to do away, this is getting very insecure, do away with all slides, which was sort of the first criteria for being a scientist, and talk directly to the issues that were the topic. And that is fertility intentions, unmet need, contraceptive choice, and the social good. Now, it's platitudinous to this group to talk about a rights-based family planning program. But the way it gets implemented scientifically and in the real world is with a very simple question to the woman that comes in at each time she has an opportunity within a health system. And that's, do you currently intend to get pregnant? And her answer to that question determines how the algorithm goes as to what services you provide. And if she says, no, I do not currently wish to get pregnant, and she is counseled on contraceptive services and what contraception is she using to prevent getting pregnant, and she says, I am not using any, then according to the Demographic and Health survey, she is categorized as having the unmet need, the second part of this talk. Now, the unmet need, most of you realize, is actually what we call in science the outcome variable to Family Planning 2020. The goal of Family Planning 2020 is to reduce unmet need for 120 million women by 2020. So that's number two. In order to do that, we have to increase the method mix of contraceptive choices, which means increasing at a population level. For an epidemiologic geek like me, it means the contraceptive prevalence rate has to increase. And probably even more importantly, by FP 2020, the distribution of contraceptive methods has to change. We have 15 methods actually now available according to the WHO chart. And those are now categorized by CDC and the authors of contraceptive technology into 3 tiers. And the top, and they're tiers that are the levels of effectiveness of the methods. And the top tiers are those that are sort of forgettable contraception, as my colleague David Grimes would say. Those that require relatively little daily or even 3-monthly or coitally dependent adherence. And it's those methods that are now, you're going to hear a lot about in this conference. Talk about gleams in the eye when we began this in Kampala 4 years ago. Now we have programs in all countries, this one especially, being given in a task-shifted way for WHO Tier 1 contraceptives, implants, and eventually IUDs. So that's the third issue. And then the fourth is social good. Now, the Gates and Kaiser Family Foundation have done recent surveys looking at the role of family planning and sort of popular support for family planning. And they found, as we all know, that family planning is not just an end to itself. It may seem that way with 3,000 of us at this conference, but it's not. It's only part, and you've heard this from all of our speakers today, of a way of ensuring global development, women's empowerment, the social good. So as we move toward the post-2015 goals, from Millennium Development Goals, which we've written about how family planning is essential to meeting all 8, not just the 3 health Millennium Development Goals. You wait. When we start having whatever let's just arbitrarily say, are 10 Sustainable Development Goals after 2015, we already have a jump start on how family planning has interacted in a multi-sector segments with agriculture, with economic development, and with microfinance and so on. And that's where we're coming from, and that's where the social good is, and that's where the innovation we've heard about today is. Thanks.
So please just stay here. We have a few questions for you.
Okay, we have one that came in from Wanja Mena. And the question is, what are other family planning methods for males other than condoms and vasectomies?
Withdrawal takes a lot of self-discipline, but it has been found in a population level to be very effective. For example, during the Depression in France, birth rates went way down, and the main method available in those times was withdrawal. So, and if done right, all of the other 12 methods that are primarily women-initiated can also be male-assisted. Male-assisted in terms of support, male-assisted in terms of recognizing what the woman's right is in that, and the couple's right in that particular choice, and making sure that she has an adequate supply on hand to meet their own fertility preferences.
Thank you. Thank you so much. I think it's going to be very interesting this week to hear from multiple partners, both private sector and other partners, that are actually accelerating progress to both new methods of family planning, but also access to existing methods in new places. Thank you so much, Ward, for sharing your insights. Next, I would like to introduce Perry Sutton, who is going to facilitate the Youth Engagement Panel. Perry is a program officer on the family planning team at the Bill and Melinda Gates Foundation. Perry's experience ranges from managing clinical training programs and health information systems to supporting bilateral health projects in several low-income countries. In addition, Perry has experience as a Peace Corps volunteer in Mali as well. She will introduce the next youth panelists as well.
Thanks very much. These are youth panelists, 2 of whom are youth and 2 are not, but all of whom work on youth issues. Yeah, so I'm here because of a core belief that all women and girls deserve the right to, or deserve the opportunity to determine their own future. I've heard it said in many different ways, but just to hear from the audience, if you agree with that statement, give a round of applause. Thank you. So obviously giving women and girls access to family planning information and contraceptives is key in achieving this. We know that up to 1/4 of girls in sub-Saharan Africa drop out of school because of unintended pregnancy. And furthermore, it's a matter of life and death. Maternal causes account for 15% of deaths of adolescent girls around the world, and that proportion is even higher in the poorest countries of the world. So clearly, we need to do much, much more to provide adolescents with family planning information, supplies, and services that they need. So let's talk about this. Specifically, I'd like for the panel to talk about ways that we can innovate and do a better job of using social media and engaging youth to achieve the goals of FP 2020. And so with that, let me introduce you to our two youth representatives. We have Makta Mikra, who is the program director for the Young Women's Christian Association of Ethiopia. So it's a great pleasure to have you. You're one of the few people who haven't traveled far and wide to get here. And we're very interested to learn about your experience here in the host country of this conference. Makta graduated from Georgetown University Law School with a master's in legal studies and human rights. And she has a passion for women's rights, girls' education, and women's economic empowerment. Next to her is Yemurai Nyoni, and he is the executive director of an organization he started, Bulawayo Youth Development Organization, and he formed it to harness youth innovation for social transformation in Zimbabwe. He's also the national facilitator of the Zimbabwe Young People's Network on Sexual and Reproductive Health and HIV and AIDS. He's an innovator, an author, an advocate committed to change in the sphere of youth and development. So, and before I introduce the other two panelists, I'd just like to get you two to open up this conversation. And Makta, maybe first you can speak to your role in reaching youth, adolescents, and some of the important challenges you see, and also solutions that you're applying.
Thank you, Perry, for the kind introduction. I would like to start by talking about the YWCA. The Young Women Christian Association has been around for a very long time. It has been a trailblazer regarding young people by involving young people and young women and also families. I would like to briefly talk about what the YWCA of Ethiopia does here in Ethiopia regarding young people and also sexual and reproductive health. We have one project that we do in Addis Ababa University regarding sexual and reproductive health and young people. That program engages young people in providing sexual and reproductive health trainings and also mentor-mentee programs that would engage young people to provide peer-to-peer education programs and also replication trainings, just so that young people could involve in having a constant conversation about reproductive health, sexual reproductive health issues. We tried to respond to the problems existing in higher learning institutions in Ethiopia because there was a huge challenge regarding sexual reproductive health issues. A lot of young people were HIV/AIDS positive. There was high prevalence in HIV/AIDS. There was a high prevalence in unintended pregnancies. So we tried to respond to that by providing several program activities in relation. So these programs are also implemented by supporting young women in Addis Ababa University, by supporting them, by providing them with bursary supports, just so that they could support their own education, because a lot of young women were engaged in intergenerational sex and sex for money because they have economic challenges. So we try to engage young women and also young people by providing sexual and reproductive health trainings, like I said earlier, economic support programs, and a unique program that we have by establishing an all-purpose kiosk within the university, just so that young people would be comfortable enough to buy their gums and condoms all at the same time and place. There's another also important program that I want to talk to you about today. It's about young people living with disabilities. A lot of young people living with disabilities don't have that access to information regarding sexual and reproductive health issues, specifically those young people who have sensory impairment, because there's a huge barrier of communication with young people with sensory impairment. So we try to address that by focusing on disability-sensitive trainings on young people with sensory impairments. We provided brailles and other communicative materials just so that young people with sensory impairments could have that access to information that a lot of other young people don't have, a lot of other young people have. So those IEC materials in braille and also audio tape are also provided for for young people with hearing disabilities. There was also a disability-focused training, and what makes this program special is we provided sign language trainings for sexual and reproductive health providers, just so that they could communicate well with young people living with disabilities, and young people would be comfortable enough to go to a health center and be provided with that service, because they would know that service provider knows their language, speaks their language, they would be comfortable enough to talk to them. So that was one of the special programs that we did regarding young people and sexual reproductive health.
Wow, great. It's a particularly interesting question, how you use social media to reach youth with disabilities and sensory impairment. You're the first person I've heard to speak to that. It's great. And to your right, we have Yemurai Inyoni, and Yemurai, who I've already introduced. We want to hear from you about the power of youth networks. It's a focus of the work that you do. And so tell us what you've seen as possible through working through these networks, and specifically how you use social media as an advocacy tool.
Okay, thank you, Perry, and thank you very much to the organizers for giving me an opportunity to speak on the panel. Well, I'll just outline 3 key networks I've had the privilege of working with. The first one is Women Deliver. There's a Women Deliver 100, which is a team of very strong, passionate young advocates drawn from across the globe. And the idea is to gather these similar thinkers together to understand how we are creating influence in different parts of the world. That initiative has gone ahead for us to have what is called the Sea Exchange initiative, partnership with institutions like Bayer, I believe, and Johnson & Johnson and other organizations. And the idea there was to go beyond just providing a platform for young people to interact, to seeing how to practically empower us as youth to create initiatives on the ground that will create a change for young women and young men also. But in this regard, looking at family planning issues. I've also had an opportunity to work with AFRIAN, that's the African Youth and Adolescents Network on Population and Development. I serve in the executive committee of that network, and it's a coalition of youth country networks from over 32 African countries. And our basic aim is to create a platform where we can organize youth participation in the African continent, looking at youth development issues. One of the initiatives we carried out there was, it's called Y for Karma, which is Youth for Karma. It's a campaign that is created with support from UNFPA, the African Union. And what we're basically doing is taking, Karma, the campaign on accelerated reduction of maternal mortality, is a high-level commitment. But for action to be seen on the ground, for decision makers to be held to account, the critical constituencies that will benefit from implementation of Karma, that's us as young people, that's women also, need to be aware of the commitments that heads of state have made and how we can hold them to account back home. So we've done that in a sense to ensure community mobilization. So what we're doing also in that regard is a lot of work on social media. We managed, for example, during the AU summit in January, we had about 3 young leaders from the team attending a high-level event with heads of state. And what we did was to take pictures of heads of state after they recommitted to Karma, and then we would share that with young people from different countries. For example, the head of state of Nigeria supporting young people's engagement in Karma. And what that does is it shows us as young people back home that indeed there is an opportunity for us to engage with our leaders because they are supporting our partnership. Finally, I've worked back home with our Young People's Network on sexual and reproductive health. So this is a network of over 1,200 organizations drawn from across the country. And our job is to put the youth voice at the center of the decision-making platforms that we have in country. But in terms of the work we've done with social media, we recently launched a campaign. It's called Young People's Network Get Engaged. It's a mixture of both online and offline engagement of young people, where we get to interface with experts, ask very simple questions, but we've also used it as a platform to try and understand the different complexities that we go through as young people in different areas. So what we've done is, because our networks have quarterly meetings where we discuss the issues within our different districts, provinces, and at national level, we use that then to capture the information that comes from those meetings insofar as identifying issues that we can take up for advocacy. And then we use that, like we did with our recently launched education strategy by the Ministry of Education, to scale up the advocacy work that we're doing with different decision-making institutions. So yeah, that's just an overview of the work that we're doing.
Wow, thanks so much. The use of social media for government accountability and the power of youth to engage in that way is so important. You're doing great work there. So now let's pose some questions to our other two panelists. To my left, I have Suzanne Petroni. She's the Senior Director of Gender, Population, and Development at the International Center for Research on Women, ICRW. And she leads ICRW's research and programs on reproductive health and rights, as well as gender and population dynamics. It'd be great for you to tell us a little bit more about that work. She's also a Georgetown alum. We have a lot of Hoyas on the stage today, probably more in the audience. And she received her PhD in gender and social policy from the George Washington University. So thanks for joining us. And over on the far side, we have Klaus Brill from Bayer Healthcare. He's the Vice President of Corporate Commercial Relations there. He's a biologist by training, and he's had a long career focused on fertility control, on hormone replacement therapy, gynecological therapy, and prostate cancer. So, Magda, why don't you go ahead and ask the first question of either of our panelists, and ask some tough questions.
I'll try. We have tried to highlight what we do with young people. My colleague here tried to highlight the social media issues. As a YWCA, we engage young people. As Bayer, what do you do with young people, and why are you focused on young people's work? Can you explain that to us?
Yes, sure. It's a pleasure for me to be here and to talk about our engagement in societies and what we as a company can bring to societies as a value. And you know, this goes back to our motto or vision, which is Science for a Better Life. And embedded in that mission statement are a couple of things to make products available to those who can afford and can benefit from the products. On top of that, we want to get innovation done not only by developing new products, but only to open up new ways how we can improve. One of those where we are engaged is education. And why is that? This goes back maybe to the year 2008, early 2009, when I met with the Director General, Renate Beer, from a German foundation called Foundation for World Population. And we talked about how we can build a better, stronger relationship between, and what can we think to do in the future. And I asked Renate, what have you in mind, what we can do different, what have been done in the past? And then she talked about, well, there is always a problem of education in developing countries like Africa, and especially Our mission in Uganda had some ideas to bring more education to very young people at primary schools. And I said, well, let it happen. And why is that? Why is it important to bring education about reproductive health to young people? And I think when you look back and you be honest with yourself, we talked about young, more in the age group maybe 18 and above. We never thought about how important it is to bring knowledge to people or to young boys and girls aged 10 to 14, which are at their entrance of their reproductive life, and to let them know what is happening to their bodies. This is why we decided to enter into a public-private partnership, and I have to say DSW is a great organization to work with, and it's really fun how we really develop that program over time and how engaged DSW are in bringing that project forward. And as a result, we thought it might be good to focus on primary schools in 3 districts in Uganda, and we covered 10 schools. And the interesting part of that is we not only thought about to talk to the boys and girls, of course, and their teachers, but also to bring in the parents. And what is, I think, very important, what we have done right from the beginning, really to engage the district political leaders and the healthcare workers. So we built a broad community on what it does take to make that education happen. What we want to achieve in those days were to increase the sexual and reproductive health knowledge of young adolescents in primary schools, create support among parents, teachers, and community leaders for reproductive and sexual health of young adolescents, to increase access, utilization, and referral of quality youth-friendly, I underline youth-friendly, services for young adolescents, and of course, to publish the project's results and recommendation. This is why I'm here to talk about it. And it's always fun to talk about good things, and we achieved good things, to be honest with you. And I think not only that, we had quite some important and significant outcomes of that, and I would only highlight 2. And the one is that the dropout rate of girls at schools significantly decreased. So in 7 out of the 10 schools, more girls finished their primary schools, which is a big achievement. I think equally important is what we have achieved on the political front, I would call it, because in 2 districts, the political leaders decided to take up the program in their school curriculum. So it becomes a little bit of a sustainable element of that educational program. But what is much more, let's say, excited to see, and here I would like to take you on a journey to Uganda, maybe into the rural areas, where you're in the afternoon sitting under a big tree, having all these teachers around you, the parents, and the big crowd of the boys and girls. And when you listen to the boys and girls, and some of them standing up and saying, a young boy said, "I have been empowered." Can you imagine what this does mean? That he really stands up and say, "I have been empowered." Or another girl stands up and say, "I learned skills how to say no." Please imagine what this does mean for girls and boys being at that age group. And I think beside all these facts you can communicate about in terms of outcome, please imagine what the impact for such young girls and boys is to have that educational efforts being perceived.
Yeah, great, thank you. I hope the breadth of that work and those innovations are disseminated and spread to reach more young people. Marai, what question would you like to pose? I see you on your tablet over here, so I'm sure you've got a number to choose from.
I had a number of daggers, so I'm just trying to pick which one is sharpest. Well, to be honest, I'm a young person, a youth leader. I work in a youth serving organization. And the sentiment amongst us as young leaders has been, we are not doing enough work. We are not seeing sufficient results so far as the status of adolescent sexual and reproductive health is concerned. So my question to you, Suzanne, is given the existing work you've done and the engagements with different kinds of leaders, how do you see the status, for example, or the way that we are investing in adolescent sexual and reproductive health changing in the next 5 to 10 years? And how can we make sure that we begin to see the results that we really want to see?
That's a great question, and thank you for not throwing a dagger at me. I've been doing this almost 20 years now, and it's been remarkable to see the growing attention to adolescents, particularly sexual and reproductive health over that time. But the field is changing, and it's moving in the right direction. So 20 years ago, adolescent health really wasn't anything on the global health scene. It just started to come onto the agenda that adolescents were a distinct cohort, a population that needed specific attention. And the bulk of that attention was around sexual and reproductive health, and rightly so, because we have these high rates of HIV infection, STI infections, early pregnancies, and we still have a ton of work to go. You heard Dr. Babatunde talk about the UNFPA State of the World Population Report. If you haven't seen it yet, the pictures are stunning and saddening. It's called Motherhood and Childhood, and it is very powerful. When you read that 7.3 million girls under the age of 18 are giving birth each year, 2 million of those births take place to girls under 15 years old. 90% of births to adolescent mothers take place to married adolescents. So people are starting to pay attention to the sexual and reproductive health issues, to child marriage, the fact that there are 14 million girls who are forced into marriage before the age of 18 every year. And this is contributing to them coming out of school, coming away from their peer networks, in many cases living a life that's akin to indentured servitude, where they really have no one but their husband and in-laws to pay attention to. So the good news is people are starting to pay attention, donors are starting to pay attention. The UN Commission on Population and Development last year held its first ever session focused on adolescents and youth. The Lancet, the medical journal, last year had a groundbreaking series on adolescent health. And this year, in fact, this week, they have an editorial, which hopefully someone can tweet around so you can all read it, a really good editorial on the importance of adolescence, the second decade of life as being absolutely critical, both to meet the needs of adolescents now and to help societies in the future, because the behaviors and the health that adolescents have now really influence them for many years to come. In that editorial, The Lancet announced that they're creating a commission on adolescent health and well-being. I'm very honored to say that I'm on that commission, and I'm actually leading the youth participation outreach. We have an open call right now and for the next 2 weeks for young leaders. We want 2 young members of the commission to participate actively on that. And not only will they be in person participating on the commission, but look in about a year from now to online participation where many more young people from around the world can engage.
Thank you. Do you have another question, Magda?
I have a question for you, Perry.
Oh, all right.
I mean, you're here and you're a representative of the Bill and Melinda Gates Foundation, so I might as well ask a question. I'm here representing young people, young women, and also women. And I was just wondering, what kind of message do you have for young people and young women and adolescent girls? If you'd like to talk about that while talking about the Bill and Melinda Gates Foundation and also your work, that would be great. Thank you.
Okay, thank you. Well, I'll say that the message to young women and girls is that you absolutely deserve to be at the center of this agenda, and that you're the future. It's pretty straightforward, and you have such power to create change as part of this movement. The Gates Foundation, our historical focus has been on the development of new contraceptive technologies and the introduction of those technologies, and at the country level on reaching urban poor. And in both of those initiatives, young women and adolescents are taken into account with the specific activities. But I will say that the Gates Foundation also recognizes that we're not doing enough in this space. I think just as the global community is realizing this, we are too. And so it's so exciting that this is the focus of the week. And I look forward to hearing more from individuals like you on what more can be done and where the real gaps are. Yeah,
if I may, I have 4 more comments to make. One is, 30 seconds. One is make men part of the solution. Don't forget about men. Number 2 is DSW together with us have developed a toolkit how you make such a program happen. Please visit the website of DSW. Number 3 is the champion of Uganda of that program is at the conference and give a presentation. So David Kafembe will present the results and all the stuff. And the good news is we agreed with DSW to open up another educational program in Kenya, which recently starts.
Thank you. I think the next panel will continue on this conversation. So I want to thank you so much for Perry for facilitating this, and thanks for the questions. I'm really happy to see this kind of panel where we actually can question leaders in global organizations and private sector companies as well. Thank you so much. So for the next panel, I would like to invite Girls Globe bloggers, representatives, and also a few representatives from the International Center for Journalists. So please welcome them. Okay, so it's really an honor for me to have this conversation because I'm the founder of Girls Globe, which is a very new organization. We're a global network of bloggers and organizations that are working to empower women and girls and raise awareness about their rights. All of these 3 young ladies on this side, I met online. We had never met before. We met for the first time at Women Deliver in Malaysia at the conference this year. And since then, we have really become an organization, and they now have individual roles. Elizabeth Epstein is from the US and is both a blogger, editor, and also our social media director. Justine Stacy is from Canada. She's a blogger as well. Started as a blogger, but is engaged with fundraising and now also the Vice President of Development of Girls Globe. And Diane Fender is from the US, Atlanta-based, and is a blogger as well, and also Vice President of Programs and developing how we can continue to grow Girls Globe, both internally and externally. Now, I want to also introduce you. We're really happy to have this conversation together with the International Center for Journalists. This is a global organization with over 30 years of experience really facilitating training for journalists on the ground and empowering them to make a difference in their communities and also engage the media and change the media, both locally and on a global scale. So I'm really happy to introduce here Elizabeth Samuel Tadesse from Ethiopia. She's a Knight International Journalism Fellow, which is administered or facilitated through the International Center of Journalists. And she is a health journalist and is now also a media trainer and is teaching local journalists to report on health issues so that it actually becomes interesting and important media coverage. And helping to raise awareness for reproductive health as a national priority in Ethiopia. With us today, we also have Sisi Fadope. Sisi is from Nigeria and has several years of experience as a journalist, and is also now a Knight International Journalism Fellow and works on training, works to train journalists and facilitate the connection between journalism and the actual issues that we're reporting on. So a lot of training about health issues, and she will be able to tell us more about that. So first I would like to just stay with the two of you and ask, what is your role in communicating the global story of reproductive health as well as in your local communities? What is your role?
Yeah, my role as a media trainer is trying to make journalists aware about health issues and making them be able to tell health stories, and those health stories should be quality. I mean, the content matters before it's going to be broadcast. So journalists should know about health issues and then be engaged with the new technology, the digital technology, so that they'll be able to integrate it with the traditional media situation we have in Ethiopia. As you know, the traditional media is playing a big role in Ethiopian community, particularly radio. That doesn't mean that the digital technology is not taking place, but the journalists should know how to use the digital medium so that they'll be able to broadcast their content and at the same time engage young people, particularly girls and women, into the discussion of health issues.
Thank you for inviting us to participate in this forum. I'm delighted to be here. So health is a cross-cutting issue, and over the last 2 days that we've been here at this conference, we found out that reproductive health especially is even more so a cross-cutting issue. So the goal in Nigeria is to have a dialogue across the spectrum of all stakeholders in the country, from beneficiaries to providers to policymakers, and giving journalists the tools and the platform to be able to amplify local voices, especially people's voices. So the goal across the board is, voice participation of the general citizenry on health issues and health policy.
Thank you. I will continue and ask the same question to Justine. What does Girls Globe have to offer, or what is Girls Globe's role in communicating these things on a global level?
Yeah, thanks, Julia. I think the role that Girls Globe plays in communicating the global story of reproductive health is really sort of takes on a grassroots approach. I think I speak on behalf of our entire Girls Globe team when I say that we really strongly believe, or actually we know that women are extremely powerful, completely capable agents of their own change. They just often lack the platform that allows them to raise their voice, especially about issues of reproductive health and rights and family planning. And for those reasons, we sort of use new forms of media, Twitter, blogging, even Instagram, to try to share our own views, as well as really facilitate the voice of women and girls in grassroots organizations around the world. So right now at Girls Globe, we have a team of bloggers around the world They're all young women under the age of 30, and I think representing 11 countries around the world and counting. And we also have a global network of grassroots women's-based organizations who also participate in sharing their voice and sharing stories directly from the field of the work that they're doing to empower women and girls. So I think we've really seen an opportunity with new social media and the sort of new journalism tools to really quickly reach a significant group of people, especially young people, in the conversation. And with topics like family planning and reproductive health that still have so many taboos and barriers because of cultural and social norms, I think it's really important we all agree that we have this easily accessible online sort of space to really enhance the voices of women and girls.
Yeah, and on that note, I think I'll continue to ask, just you mentioned the challenges. And so what challenges do you see in your local communities? And also when having this discussion on a global level, what are the challenges you see? Also in terms of digital media and the form of media you use.
Yeah, as you know, family planning and reproductive health issues, particularly in culturally conservative societies like Ethiopia, discussing them openly is challenging for women and girls. And if journalists are going for interview and asking women and girls what kind of contraceptive methods that they are using and the like, they are always having all those challenges. And granting anonymity for interviewees is also a big challenge because one could identify the voice or the face, and it has been a very challenging situation for journalists. But the coming of the digital technology, particularly mobile phones, is changing the whole thing. Like women are controlling the information that they are providing, and at the same time they are getting. So it has changed everything. Women are trying to communicate with other women, with expertise and the like, by hiding their names, their faces, even creating false sort of account, but the message is still real. So the digital media has changed the whole communication barrier that the traditional media has been facing. Yeah.
So Nigeria is, of course, huge, and the media is also very vibrant and very vital to reporting about health issues. But you find that sometimes the access to the people who are making the decisions isn't always easy for some journalists. So part of the goal is to help journalists get access to decision makers. The other part of it, of course, is a lot of people are still not literate. So getting information in such a platform where they can understand it, where it's useful to them and they can use it to make decisions is also part of the challenge of improving how journalists and young people receive that information, whether it's via SMS or via radio. I was a radio journalist, so I'm partial to radio medium as a way to communicate information to young people. Using music, because music is very important to young people. So going through those routes and paths to reach young people with family planning information in an environment where they can easily receive it is useful. It's part of the challenge.
Thank you.
Yeah.
I think that there are so many ways that we can work together to really convene traditional and new media, both to reach the grassroots level, but also get the voices of the grassroots to this kind of forum. Unfortunately, we're running behind schedule, so I will have to round up our discussion, but I believe that we have a lot to continue to talk about. And please reach out to us, and both to the International Center of Journalists and to Girls Globe, and we would really like to enhance your voice in this discussion. So I would like to thank you all for being a part of this panel, and we'll introduce our next speaker, who is going to introduce our final speaker. So thank you.
Thank you.
So to introduce our closing speaker is Maureen Greenwood Baskin, and she's the Executive Director of the Universal Access Project, and also the Director of Policy Initiatives in the Women and Population Program of the UN Foundation. So, welcome.
Thank you so much. Wow, what an interesting array of speakers that we've heard today. Shall we give them a hand? I want to thank the Packard Foundation, FHI 360, and especially call out my colleague Catherine Brandon from the United Nations Foundation for making this such a great success. It's more important than ever that we engage all of the voices and spark global conversations about the issues that matter. I'm also grateful to all of you in the room and outside of the room that are using the power of social media to amplify the voices of what's being said here today in Addis Ababa. We know at the heart of the matter is the urgency that we feel to empower the world's hardest to reach, most vulnerable women and girls. And we know that there's no better way to do that than to invest in voluntary access to quality family planning and information and services, as Dr. Asha Tamain said. It's also important to think about the theme of how we're addressing the issue of family planning. We've talked about partnerships, technology, media, mobile, youth, and science that are so pertinent to family planning. The family planning community is also a great example of partnerships. The Secretary General at the UN's Every Woman, Every Child campaign has brought together global commitments on international family planning, as well as we heard today from Family Planning 2020. We also have seen the power of traditional and non-traditional media platforms, including this, plus SocialGood, and I have to say it's been a dream of mine for many years to see a plus SocialGood just on family planning, and to see it coming out of Addis is really exciting. And we also have harnessed the power of youth and of science. We've made tremendous progress, but we still need to do more. We know that more than 215 million women and girls around the world want access to voluntary contraception, but here we are in this day and age, and they still don't have it. We know that we have approximately 700 and some days left of the existing Millennium Development Goals to reach MDG 5B, universal access to sexual reproductive health and rights. And we know that that was the one issue that was left out of the original Millennium Development Goals when it was created in 2000. So we have work, everybody in this room, as the United Nations considers the next post-2015 development framework. We need to make sure that it's not the issue that's left out again, but that women and girls, gender equality, health, and youth are central to the United Nations post-development framework. With that, it's my great pleasure to introduce Laura Turner Seidel, Director of the Turner Foundation. She is so much like her father, Ted Turner, the historic leader on population and reproductive health issues. Laura is committed to ensuring that women and girls have their full potential realized. She's an extraordinary woman who wears many hats: mom, daughter, philanthropist, environmentalist, an eco-living expert, and I've been actually hearing about being an eco-living expert the last 2 days, which has been a lot of fun. But she still manages to be one of the visionary leaders on women and girls around the world. With that, Laura, the floor is yours.
I'm just delighted to be here and to be part of this amazing conversation. I feel like I've been drinking from a fire hose already. We were at the high-level ministers meeting this morning, and just hearing the commitments from the ministers to improving the lives and the future of girls and women is so powerful. And I really think that over the past 10 years, we've really come a long way on this issue. I come from a family, Ted, what can I say? Ted Turner, who has been about women's and girls' issues, empowering them, gender equality. When I was growing up, he would talk about female genital mutilation. I've been told now the more sensitive thing to say is female genital cutting. But, you know, and people would have to lift their jaws up off their chest because they were in shock about the topic of the conversation. And I think an aha moment really for me was after a trip to Nigeria about 4 years ago with the UN Foundation. Kofi Annan hosted that in Ghana, and then we stopped in Nigeria for a couple of days. And that's where we learned that it was 60% of the women there that wanted access to reproductive health care and contraception options and couldn't get it. That was a whopping 36 million women out of the 222 million women that want access and can't get it. And I think that this is such an important issue, truly one of compassion, to help the girls and women that are our sisters and our mothers and our daughters achieve their dreams and hope for a better life. I am an environmentalist. I spend a lot of time working through our family foundation, the Turner Foundation, and several other boards. I don't know if you've been watching what's been happening in the Philippines, and we have to make sure we get this energy and climate thing right, because all the effort that we spend on empowering women and girls and educating girls and giving them options, if we don't make sure that there's water for everyone, fresh, clean water, and that there are other resources that they need and healthy soil to grow healthy food, and we don't, you know, we've got to, like Wangari Maathai, plant lots of trees to stop desertification and climate change and improve the situation in microclimates. You know, what's going to happen? More Hurricane Sandys, more typhoons like we saw in the Philippines. In Australia, they had to come up with a new heat index because they had never experienced the heat before. I think they came up with a new deep purple color. And in Nevada, where I'm from, in Death Valley, it was 135 degrees Fahrenheit. We have got to adapt, we've got to mitigate, we've got to figure out what we're going to do about climate and energy. And you know what? Empowering women and girls will help them get their voices, will help them understand what needs to be done. And they need to start putting pressure on the right places. They can become leaders themselves and put pressure on our leaders to make sure that, that there's a healthy life support system in place and that we all truly have a future to look forward to. There are a couple of housekeeping things I would like to point out. We've got a couple of hashtags that you need to make notes of because we want you to tell your stories, what you've heard today, what you'll hear for the rest of the conference. Hashtag ICFP 2013, hashtag 2030 now, hashtag SocialGood, and finally, hashtag family planning. So just make sure that we're harnessing the power for social good and for these very important issues. So I charge you with that. And then also there's one other thing, that moving forward from the MDGs, of course there are gaps, and you know, in 700 and something days we'll be transitioning to the sustainable development goals. And if you want your voice to be heard, if you have input, there is a place that you can go. It is a survey, and that is My World Survey. So myworldsurvey2015.org, and please let your voices be heard. This is the time to act, and act now. And let's see if there's anything else. I just want to thank The organizers, FHI 360, the United Nations Foundation, and the David and Lucille Packard Foundation for organizing this. And then also I'd like to thank the panelists. Thank you for being in the trenches every day of your career, for being so passionate, for being here, and for continuing to do the heavy lifting to make this world a better place for women and girls and for all humanity. So without further ado, I'll let you get on to the rest of your amazing day, and I look forward to seeing you at the opening ceremony. Thank you very much.
So thank you, Laura, for those closing remarks. I just also want to thank everyone who has participated today. Your voice will be heard, and your voice is already heard, which is amazing. And thank you, Laura, for sending us off with some inspiration and motivation and positive attitudes for the future, and we will make a difference. ICFP Live, keep the conversation going this week. Thank you so much.